Welcome to all of you, my dear friends. And today we will learn about the dental health awareness for holistic health. So I would like to begin my presentation with this picture. What do you see in this picture? Can Dr. Ranjan or Dr. Sandeep tell me, what do you see?
Ma'am, in this picture, both father and maybe son are very happy, and one of the teeth is missing. Father's teeth is missing.
Yes. Now, we look at it closely. His eyebrow also is missing.
Right. Yeah.
But the attention goes on to the tooth because we always look at the teeth first when we look at the person in front of us. We look at the smile in the teeth first. So the attention will go on to the tooth rather than on the eyebrow. So it is very important to look after the teeth, right? Now, in this presentation, I have designed it in a way that I want to cover many topics. So first of all, I'm going to cover these topics: that importance and functions of teeth, identification and awareness about baby teeth and permanent teeth, dental diseases like caries and gum disease, how it spreads and how to prevent it, myths about dental treatment, effects of dental health on general health, correct technique to brush, information on diet and its effect on the teeth and how to prevent dental diseases, harmful habits, dental treatment for children, dental treatment for adults in terms of restorative and replacement options. Can the teeth be aligned? Why orthodontic treatment? And what kind of treatments are possible? Since I'm an orthodontist, I'm going to show you some magic of braces also. I will be showing all these things with case reports to explain all the points that I have covered. First of all, for many of us, the dentist means a doctor who deals with teeth. But in dentistry, there are 8 branches. Orthodontics deals with braces and alignment of teeth and jaws. Endodontics deals with root canals. Periodontics deal with gum problems. Pediatric dentistry is for children's teeth. Oral maxillofacial surgery involves with the surgeries of the jaw and the face. Prosthodontics is for the replacement of the missing teeth, that's called prosthodontist. Oral diagnosis in radiology primarily is for diagnosing the oral lesions, precancerous lesions, etc. And preventive dentistry deals with the prevention of the dental issues. Now, as you all know, smile is the curve that sets everything straight. For developing great relationships, a beautiful smile goes a long way. We feel confident when we are able to smile heartily. For having beautiful smile and feeling so good about yourself, it is important to have healthy teeth. And the functions of teeth, as you all would know, is for chewing food, for biting into fruits, for proper speech and articulation. If you don't have teeth, our speech would get affected. For having good smile, of course, and for supporting facial muscles, because as we lose our teeth, the support to the facial muscle goes, and then we would look more old than our age if we have lost teeth. And of course, for having a proper relationship between upper and lower jaws, because if this is basically a doorway to your health, your teeth are the doorway to the health. And when this is a chewing machine. When you chew well, your overall health remains proper. And so it is very important to have healthy teeth. Go back to basics. We have 2 dentitions. One is deciduous dentition. This consists of 20 teeth, which erupts at the age of 6 months to 6 years. I know that all the established doctors who are so wise don't need this basic information, but this lecture will be also seen by other people. So I'm going to the basics here, that the deciduous dentition or the milk teeth, we have 20 teeth. The infant begins with the eruption of baby teeth at the age of 6 months to 6 years. By the time it is 6 years, child is 6 years, all the baby teeth are present. Mixed dentition phase, where the baby teeth are falling and the new ones are coming in, that phase is from 6 to 12 years. And permanent dentition is from 12 years onwards. Wisdom teeth would erupt at the age of 18 to 25, generally, and remaining teeth would be already there before around that age. Now, sharks are blessed with so many teeth. And tooth is the only part in human body that cannot repair itself. The sharks would have so many 5 rows of teeth, and it would have probably 3,000 teeth at once, and it would lose probably 100 per day, but it can fix itself. But we as human beings don't have that advantage. So we have to take responsibility for our dental health. And let's begin with children. When you have a very young child, what you see? Tiny little teeth on that angel's mouth, and these are incisors, and these are canines, and these are molars, primary molars. And these teeth also have to be preserved carefully because they are contributing to the speech development, to the confidence development, to the growth and development of the entire maxillofacial area. So it's very important that these teeth are preserved properly. And then we have permanent teeth. Now, as you can understand that there were 20 teeth here. So these, all the teeth will go and the new ones will come. And that is where we will get the premolars. So from here to here, the teeth will be replaced. From premolar to premolar, there is a predecessor. But first permanent molar doesn't have a predecessor. So is the second molar. So when you see a young child, sometimes ऐसे होता है कि मैं बोलती हूँ कि आपके बच्चे के परमानेंट दांत में कैविटी हो चुकी है, तो वो बोलते हैं कि वो उसके कोई दांत तो गिरे नहीं, तो ये परमानेंट कैसे हो गया? लेकिन the first molar is the first permanent molar is the first permanent tooth coming in the mouth at the age of 6 years, and that can get decayed if the child is eating chocolates and sweets and good brushing habits are not inculcated in the child. So these are the permanent teeth, and then we have to, as physicians and as doctors, sometimes what happens, we tend to forget about looking at the details. Like when the patient comes with tonsillitis to a physician, the physician would go straight to the throat, to the tonsillar area, identify the issue and prescribe the medication or pay attention to only that area. But if you look at it with a little wider perspective, we could probably guide the patients that please clean your tongue twice in a day with a tongue cleaner, brush your teeth properly. If you see some cavities, we could surely guide the patient that please go to the dentist to get the treatment done so that you don't suffer. Now, as I said, the doctors here don't require this information, but the purpose of sharing this slide is to explain certain myths. You can understand that the nerve supply is coming from the brain, and then it has got major branches, and there are small branches which are supplying the teeth. So if you are extracting a tooth here or here, it cannot affect your eyesight. So that takes me to the myths about dentistry, that the eyes get damaged by extracting upper teeth. That's a myth. It cannot happen. You know, if the extraction of the teeth is performed, then the nerves get pulled and people get headache and they get mad and all that. That's all wrong beliefs, wrong myths. It is not important to fill the teeth. If the tooth pain, just get them removed. Put something artificial there. That's not the right approach. Natural is always better. We should take care of the natural. Whatever is given by God has to be maintained by us. It's our responsibility to look after our body and our teeth. If you get cleaning done, the teeth will get weak. That also is a wrong notion. Why care for milk teeth? They are anyway going to fall. I already mentioned that why they are so important. And dental treatment is always very painful. Now, I have to tell here that the dental treatment can be painless because the doctors are very compassionate. They would give you local anesthesia and do your treatment. But if the condition to begin with, because of the patient's unawareness and negligence, is that the condition is so bad that the patient is in excruciating pain, patient certainly feels a lot of pain because of the teeth which are decayed and destroyed. So how to prevent painful conditions in regards to teeth? For understanding this, we need to go to the basics. If we understand the basic of tooth anatomy, what is seen in the mouth is known as crown, and what is seen, what is not seen, what is inside is the root. Root is embedded into the bone, supported by certain elastic ligaments, and on top of it, we would have the gums. Now, when we look at it closely, the outermost layer is enamel, which is the hardest structure in the body. The second layer is dentine, and the inside layer is the nerve and blood vessels. This tooth is in the bony socket, and there are gums covering this particular tooth. Right? Now, imagine if you are shaving and if you cut somewhere, or if you get a pimple somewhere, or if you get a boil somewhere, the skin expands and you feel the pain. You know that something is not right there, but the pain is not really excruciating. In the tooth, the pain is excruciating because it happens in this area and there is bone, there is hard bone there. So you feel a lot of pain in the tooth when you have dental infection. There are two main diseases of teeth. One is dental caries, and second is periodontal problems or gum problems. Plaque, dental plaque, is the main factor to cause dental problems. And these two diseases are like silent killers. As I have explained here, that the nerve is right inside the tooth. If this skin has got nerve everywhere, so we feel that okay, I have something not right, so I can sense it immediately, and then I can take corrective steps. But inside the tooth, when the nerve is right inside the tooth, for us to feel the pain, feel the discomfort, the nerve has to reach till the nerve, and the nerve is right in the center, in the pulp, in the center, protected by both the heart structures. So you don't feel the pain. So waiting for the pain in the teeth and then going to the doctor for the treatment is actually a bad idea. It's best to get it checked and prevent problems before you even get any pain. So as I said, these are silent killers, dental caries and periodontal problems, because it doesn't pain in the beginning. You don't even realize that you are having these problems. Why does this happen? The dental plaque is the one which is, when you look at it, it is a thin sticky film that coats the teeth that contains bacteria. And this damages the teeth. It can cause to the tooth loss. Under the microscope, it looks like that. And this can be simply removed by brushing nicely and properly before it gets hardened. It gets hardened only if it stays for a number of hours. So we have to brush it off properly by brushing twice in a day. Very simple. When you remove the plaque regularly from the teeth and you have taken care of all the other factors in terms of diet and maintenance, then you should not have so much of painful conditions to suffer about the teeth. So role of plaque in dental decay would be that when you have bacterial plaque collected onto the tooth, and there is sugar or starch in the mouth, it is not cleaned, these two interact and produces acids. When these acids are produced on the susceptible tooth, it begins to eat away the mineral part of the tooth and you develop cavity. This is a healthy tooth. And then when the small little hole happens into the tooth, the cavity begins, and then it begins to get down into the dentine. When it is in enamel, you don't feel anything. When it is in the dentine, you start feeling hot and cold sometimes, off and on, and then when it goes deeper and reaches the nerve, that is the time when you develop swelling or when you develop severe excruciating pain in the tooth. Why do you feel the pain so much? I have already told you that the bone does not expand. So at that point in time, bone destruction has to happen for the abscess to spread there. And that is the time when you get severe pain in the tooth, you get sleepless nights because of this pulpitis and severe infection, periapitis. Then what happens? At this stage, patient may remove the food with a toothpick or some safety pin or something. Because it is still not paining, patient may not go to the doctor. But here, the patient will feel so much of pain that the patient will say, "Arey doctor, mera daant nikal do, bahut dard ho raha hai." Lekin at this point in time, also, if somebody has not gone to the doctor, then this abscess will come out from the gums and it would appear clinically like a boil. And once the boil bursts, the patient will feel better, the pain will go away. But the destruction of the tooth will continue. So these are the stages of progress of the dental decay, and we need to prevent this dental decay by taking care of the teeth when they are healthy. If they are not healthy, if we find out that they are not healthy, there are some problems, then we have to get it sorted. We have to get it restored. I'm going to talk about it, treatment and solutions also. So this is some images that how the decay progresses inside the tooth. And how do you know as a layman that do you have a cavity or not? So if you have a black or brown holes in the teeth, when you look at the mirror, open your mouth and look at the mirror, do you have black or brown holes in the teeth? Do you feel that the food particles are getting stuck in your teeth while eating? Do you feel hot and cold sensitivity? Do you feel pain somewhere in the teeth? Or have you noticed that you are unable to chew on one side and you tend to chew only on the other side? Because if you take the food on that side, it is paining. Well, if these are the things that you are experiencing, it's time to visit the dentist and get the treatment done. So now you know. Now, when I have already explained about the baby teeth at a permanent teeth, so when you observe this carefully, you can see that this baby tooth is decayed, this root piece is left here, this root piece of baby tooth is left, and the permanent teeth have erupted, and this tooth is decayed. When you look at it closely, on the lower teeth also there is black bruise and there is a hole going there, there is a decay, right? Then you look more closely, you can see that this particular tooth has got a lot of rotten structure inside and some food particles which are rotting inside. So these kind of things, if you see in your mouth, then you should go to the dentist. If you don't see it, if you are unable to see it, then also every 6 monthly you can go to the doctor. Doctor can fix your teeth by treating them properly. Now, when you have this kind of discoloration and doctor tells you, because the doctor puts the explorer and it kind of catches there, and the doctor says the decay is progressing in this tooth, trust the doctor because the doctor knows that the decay is progressing and you require to get the filling done. You may not get any pain, but if the cavity is progressing inside, it's in some time you are going to get the pain and more destruction of the tooth will happen. Now, what are the solutions for these? The solution is that earlier times we were doing the silver filling for such decayed teeth. Now we have beautiful composite material with which we can do beautiful artwork in our patient's mouths. When the tooth is decayed like that, this patient has got so much of swelling in the gums and the teeth are decayed. After cleaning, deep cleaning procedure, after bringing the teeth gums back to health, the restorations are done. And the tooth now is normal and the patient has to maintain the teeth properly. The restorations that we do are inert material. They cannot get damaged when the strict protocols are followed by doing the things. And then if the patient is maintaining the hygiene properly, then things will remain good for a good time. But if the patient does not maintain the hygiene, that near the margin of the restoration, the new decay can develop. So it's very important that the patient learns to maintain the teeth properly. Another case where you have back teeth which are decayed, you remove the decay and then you do the filling over there. Another case where you have the decay, but under the old filling, the secondary decay is progressing. Now in this case, we don't just go by the visual and the tactile sensations. We use certain chemicals to remove the decay from the tooth. And once the decay is completely removed, suppose in case if the nerve is exposed, which is inside, then we protect it by some healing material and then we rebuild the entire tooth. If the bacteria have not migrated into the nerve, then this tooth can remain as it is. And if it is migrated, then this tooth will require root canal treatment. Now, some people are scared of root canal. So what is root canal? Some patients ask me, will my tooth be removed after my mouth when I'm doing root canal? Is root canal very painful? No. The thing is that let's learn about it, that we put some pointed instruments all the way till the apex, remove the dead necrosed nerves and infected blood vessels and everything from inside. If there is any infection in the root area, that also is allowed to drain. Yeah. And after that, the filling material is done with some inert material. And then the top structure is restored. And then the cap has to be put to protect this tooth. Example, how will it look? This patient has got old silver filling where the margin is broken and the decay is progressing inside. We have opened the tooth, the nerve is open. So we have put those instruments inside, root canal is performed, and then the filling is done. Now this tooth will require a cap. So this is what the good, well done root canal would show, that the infection is cleared all the way till the apex and nicely filled up. Another case. Now you would understand. Now as you look at the picture, you will be also able to notice that, okay, this is decayed, this is decayed, oh, there is something wrong here also, right? So the mind will, like eyes will see what the mind knows. We have already shared what is decay, how does it look like. So now you know that, okay, this is the case in which there are multiple teeth which are decayed. I think there is something missing here, right? Now you also can see that. We have removed the old silver filling, we have removed the decay, and what do we see? On the X-ray, we see there is a big infection there. As you can see here, the black shadow is touching the central shadow, which is of the pulp, and the infection is progressing inside this tooth. This tooth underwent root canal, and then the patient had nicely healed bone after that. And this is how we put the caps for this teeth. We restored the decayed teeth. She has to go for the replacement over here. Her smile improved after doing the restorations, and now she's in much better healthy state to maintain her teeth nicely and properly. So we have understood the first problem, decay, caries. Decay, causes, and what are the solutions. Now, other problem, second silent killer is the gum problem, right? Branch of dentistry, periodontics, would deal with the diseases of gums and supporting bone. So how does the gum problem happen? There are bacterial plaque, which is there in everybody's mouth. The bacterial irritants are created because of that, and the gums get inflamed because of these irritants, and you develop gum disease. Right? Let's learn more about that right now. So this is the healthy tooth, healthy bone, and healthy gums. When this particular plaque collection happens near the neck of the teeth, and the patient is just not taking care in terms of the oral hygiene, what is going to happen is the gums are going to get swollen up. When the gums get swollen up, it's called gingivitis. And when the gingivitis happens, the gums start bleeding. At that time, generally people get scared. When I'm brushing, it's bleeding. So maybe I need to be careful that, I must be injuring myself. And they get into the vicious cycle that they don't brush well. When they don't brush well, the inflammation of the gum increases and the bone destruction begins. If they have still not, they are not getting any pain, only bleeding comes. Okay, and they feel that I'm managing by doing it differently and I'm not bleeding now anymore, but actually the disease is progressing inside, as you can see. Now, as it grows deeper, like patient is still not having any other symptom besides the bleeding gums, and then bone destruction begins. When this much bone destruction has happened, that time the tartar formation would have happened all around, and then the bone loss would progress, and then the teeth becomes loose because there is no bone. So the teeth become loose. Suddenly, one fine day, one feels that, oh my God, my teeth are shaking. Or when the patient goes with so much of tartar to the dentist, and the dentist cleans the teeth, suddenly feels, patient concludes like that, oh, my teeth were okay. Earlier they were bleeding, but there was some tartar, and the doctor removed it, and my teeth became loose. But was it because of the cleaning that they became loose, or was it because of the bone loss that it became loose? So the bone loss can be prevented by taking care of your teeth when the bone and the gums are healthy. How do we know that do I have gum problems or not? So do you have spongy gums that bleed while brushing? Do you have black or brown deposits on the teeth? Do you notice that sometimes there is bad smell coming from the mouth? Pus is coming out of the gums when touched, or teeth are shaking. You touch and feel some teeth are shaking. Do you think you have that? Or are your teeth drifting? Earlier, your teeth were all aligned beautifully, and now you're noticing that they are drifting. There's spaces coming between the teeth, and they are just shifting and drifting all over the place. Maybe it's time for you to find out whether you have a gum problem or not. So when you have the plaque, you can prevent it. You can just simply brush it off, clean it off, and prevent formation of tartar. But tartar looks like this. It looks like a black and brown deposits which are sticking on the teeth. And when they are sticking there, how much ever you scrub on top of it, it will not go. So it's very important to get the teeth cleaned at that point in time. So this patient, cleaning was done, only cleaning was done, and you can see that the teeth are looking so much better. Now here you can notice that these gaps are there. Why are they there? Because there was tartar, because it began to drift the teeth, right? So that is why the gaps are seen. Here the gum has receded, as you can see. The other gums are at one level, this gum has receded, but then it is not going to regrow. We have to maintain it at that. Or if it is receded, we can do some periodontal plastic surgery and do the recession coverage. That also is possible, but it has to be examined and evaluated by your dentist and periodontist to plan that treatment for that patient. Another case, a young girl who comes with the teeth which are having so much deposits. The teeth are already drifted. There are spaces between the teeth. The pus is oozing from the teeth. And she, when we examine her X-ray, she has got so much of bone loss. And at this stage, we do the deep cleaning, polishing and root cleaning. We do the surgery of the gums, and then we remove all the granulation tissue and all the infected stuff from there. After that, we put braces. We put braces and we very we apply very light forces, and we align and level everything. We close all the spaces, and that's a change in the smile and the appearance of the patient. So it is very important for us to remember that the dental plaque has an impact on general health. Studies have shown correlation between repeated throat infection, increased formation of arterial plaque, leading to coronary artery disease and stroke. We don't know that, but the articles are coming up. They are finding the correlation between the two. The presence of plaque also has an impact in controlling diabetes. The rapid destruction of the bone in diabetic patient is seen where patient does not maintain good oral health. So the diabetologist also needs to pay more closer attention to the patient's dental health. If the patient is not maintaining health and the sugar is not coming under control, it's a vicious cycle. We need to break it somewhere. Hormonal changes with pregnancy and menopause also impacts the dental health of the patient. So one has to be vigilant. And of course, maintaining vitamin D levels in the body is very critical for the general health and dental health, right? Some journals have mentioned the research linking the gum disease to heart attack and stroke. Study presented in 1997 in American Association for Advancement of Science meeting suggests that the bacteria present in gum diseases may trigger blood clots, which can contribute to heart attack and stroke. This was mentioned in 1997, it's old research, and the more data is being collected in this topic. Gum disease, also known as periodontal disease, is one of the most common infections, often more prevalent than a common cold. Common signs of gum disease include bleeding gums or pus between the teeth. Left untreated, this chronic infection can destroy the bone and supports of teeth and may lead to tooth loss. I already explained all these things with the earlier slides. The academy urges people who are at risk of cardiovascular diseases or have signs of gum disease to consult with a dentist experienced with treating periodontal disease. Regular periodontal screening and evaluation, treatment, and professional maintenance are critical to the long-term management of periodontal disease. It's very important that we wake up and we guide our patients and we help them to have better dental health. Also, the relation has been established. Of course, we know that because of tobacco, oral cancer can happen, but the relation between the pancreatic cancer, esophageal cancer, and colon cancer has been established in correlation to the plaque formation. In the dental person's teeth are not good and the maintenance is not good, they also are kind of at a risk for developing those cancers. So my question is that why people don't seek dental care and suffer? The answer could be plain ignorance. They just don't know, right? They don't know. So how do they take care of the teeth? They don't know. There could be fear of pain. Some people are really scared of dentists. And there could be fear of dentists, doctors, dental setup, injection, everything. There could be lack of guidance by physicians or other doctors who are not widening the perspective. They are not looking at the holistic thing and they are not guiding them. So they are the first contact points. Maybe they should guide the patients that please go to the doctor, dentist to get your dental checkup done. And time and financial constraint also could be the factor for some of the people. Now, where there is a will, there is a way, and we can invest on our dental health by taking care of our teeth. Right? What are the solutions? Create awareness in the society at large, right from the beginning, that the dental care is important. So that's this particular, I'm really grateful for this opportunity to share all these things with you, because this video will be seen by many other people, and it would be a contribution to the society in that way, that the people will get more and more aware that these things happen and we can prevent it. We have the power to prevent it. You know, we can counsel and guide the people for seeking regular dental checkup done, just like annual maintenance for the aquaguard. Like we never think before deciding that we require annual maintenance for aquaguard. We require it. We understand it. We never reach a situation where we would have a flat tire on the road. We will make sure that our tire air is checked, air pressure is checked regularly. We have sufficient gas and petrol in our car regularly. We do the regular service of our car. This is a machine which we have to take care, and we have to do regular checkup for research. For fearful patients, provide compassionate counseling and treat them with patience. This is what the dentists can offer. And for deep-rooted fears, consult a therapist to find out root cause and begin the healing process. That's what I recommend. In our clinic, we integrate spiritual sciences in our training. Me and my husband both are soul coach. We both are trained in so many healing modalities. So our approach is very different in terms of, we just don't look at that this is a dental clinic and person has a toothache and we are treating only the teeth. We integrate our spiritual science and our training as therapists in various healing modalities by helping patients, by making them relax, first of all, with deep breathing. We may not tell them that we are teaching you meditation, but they will, by default, learn anapanasati while they are on the dental chair. At times, some of the extremely anxious patients, I would do Tibetan sound bowl playing so that they get into the very deep state of relaxation before I start the procedure. And of course, counseling and being very, very perceptive about patients' needs, because patient's mouth is open. Little frown there, little jitter in the leg, little jitter in the hand, fingers, little tight holding of the handle. We are very, very observant about what's happening to the patient while we are treating the patient. And we provide compassionate care for our patients at our clinic. So I believe that as doctors, we have to use our intelligence and analytical ability to plan the case well. We have to have the compassion and conscious heart to treat them with a lot of care and love. And we have to have blessing of the skillful and caring hands. When we touch them, when we do their work, we have to do it very carefully and gently. What can a patient do? What can you do? So you have a power to take care of your teeth, as I was mentioning. So when the plaque is soft, you have to brush well. So the technique is very important. Your dentist can surely show you. I'm also going to show you. The frequency must be twice in a day. Clean the tongue with tongue cleaner. Use the toothpaste with fluoride and do flossing. Visit the dentist every 6 months for the regular dental checkup. The brush has to be at a 45-degree angle and you have to swipe it down so that you are taking away all the plaque from the surface, from the neck of the tooth. On the back teeth, there has to be to and fro motion so that the teeth are clean when the food which is sticking is removed. Twice in a day is very essential. The inside surface sometimes is missed. So the inside surface also has to be done really well. Then the brush needs to be changed periodically. And this brush, like 2.5 months, depending upon your usage, how hard you are using it and how it is getting spoiled, you just change it every 2.5 months. In COVID times, we were recommending that if you have got COVID, please throw away the brush after you are out of your quarantine and use a new set of brush. And even your family members who are using the same area to keep the brushes, like you should separate it out. You should not kind of have a contamination. Also, you can use the power brushes, electric toothbrushes. These brushes are very effective, provided they touch each and every surface of your tooth. If you just go zoom, 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 it will not clean it. So it has to be sufficiently, time has to be given so that on each tooth, each surface, it is moving sufficient number of times to take away the plaque and the food from everywhere. And it's a visual thing. You can actually see that is it clean or is it dirty. And then if it is dirty, then you do it again because they are your own teeth and you have to look after them. For the proximal cleaning, the flossing can be done and the water pick also can be done. The water pick also helps in the proximal cleaning, and also the proxa brush can be used to clean the teeth interdentally between the teeth. Right? Now, I have been giving these webinars for many times, and what I thought that let me ask some questions that could be running in your mind and maybe answer them. Okay, so when can I give the toothpaste to my child? That would be the first question in the mind of a young mother. So when the child is able to spit out properly, that time only you give the paste. Till then, you just brush. When the child is having very small baby teeth, that time you can use finger brush and brush. After that, you can use the regular baby brush and brush the teeth. And at that time, initially don't put the paste, but when the child learns how to spit out, you can use the paste. Which toothpaste is good for children? Fluoridated toothpaste is best, but the 500 ppm of fluoride should be there for the children's paste. Is mouthwash helpful? How? And which one should you use? The mouthwashes can be used only after brushing the teeth. Mouthwash instead of brushing is not recommended. Mouthwash with fluoride, mouthwash with chlorhexidine would be helpful to reduce the incidence of bacteria in the mouth. Chlorhexidine especially is helping to reduce the incidence of the incidence of the bacteria in the mouth. And the fluoride will protect your teeth from attack from the teeth, from the bacteria. Which paste is good for adults? Any paste with 1000 ppm of fluoride is helpful to clean the teeth, and that would be helpful to protect them from the cavity formation. What do you do if I have sensitive teeth? Abrasion, abstraction, wear and tear, acid reflux, these are the causes. The neck of the tooth is having the breakage and all that. So you have to basically find out what is the cause of the sensitivity with your dentist. If it's a wrong brushing technique, maybe you should correct that. If you are having acid reflux and wear and tear because of that, then that has to be corrected systemically. And if you are having the clenching habit because of which you are having the wear and tear at the neck of the teeth, maybe you require to do some stress management with some meditations. And also you can wear some kind of guard to protect your teeth. Why do I have bad smell from the mouth? The bad smell from the mouth can happen because your tongue is unclean, there is plaque on the teeth, or there is some kind of reflux or indigestion issues, or even the nose infections can give kind of a smell in that area of the nose and the mouth. Can we use things like soda bicarb, vinegar, etc. for whitening teeth? Please don't use abrasive products on your teeth to whiten them. Clean is good. White is not essential. Natural tooth color has to be preserved. All the surface stains and deposits have to be cleaned and then maintain it that way. That would be a good idea. But don't use any abrasive products, otherwise you'll be damaging the enamel of the tooth. Now we all know that the healthy food habit should be there. Food rich in vitamins, minerals, calcium should be eaten. Balanced diet, I shouldn't be even mentioning all these things because we are all very aware about it, that we have to have balanced diet. Sometimes we do tend to indulge into these things, especially children. They want to enjoy all these foods. And I'm saying that if they want to eat sugary food, they are eating it, they are indulging into it. Well, what we can do as adults is we can empower them to brush their teeth within 20 minutes. Why? Because this graph is showing that the food intake, whenever it is done, the pH level of the saliva goes to acidic. And when it gets into acidic, the beginning of the cavity can happen into the tooth. And this happens within first 20 minutes. So generally, children have habit that when they eat chocolate, they will allow the thing to melt in the mouth and linger the taste in the mouth and all that. So allow, instead of that, give them this goodies whenever they want to eat it, but then they have to brush within 20 minutes. If the child is kind of coming back from school and in the bus, the child is eating a chocolate and then not brushing the teeth at all for a long time, the child will be definitely getting cavities. So it's important that we teach them that you must brush your teeth within 20 minutes of eating sugary foods. And another thing is that if you don't have a possibility of brushing, then at least rinse your mouth with water, drink a lot of water, and rinse it out and clear the mouth of the acid environment. The third thing one can do is that give a piece of cheese to the kid, because the cheese will turn the pH of the saliva a little more towards alkaline. And then when the child is home from school, then the child can brush the teeth if the child is eating those sweets. The habits like smoking, tobacco, pan chewing can lead to cancer. These are weapons of mass destruction. This can cause the cancer of any form, oral cancer, lung cancer, etc. Orally manifestation would be to have these kind of brown stains and completely dirty teeth, and the patients can lose the elasticity of the muscles. They will have white lesions, they will have submucous fibrosis, the inability to open mouth, all that can happen. And these patients, when they develop cancer, then there is disfiguring happening. Severe suffering happens to these patients, and we have to educate them. If they are into addiction, we can kind of guide them to de-addiction programs so that they stop these destructive habits and self-deprecation habits, and they are better. When they lose their jawbone or when they lose their entire section of the jaw, then there is a lot of disfigurement. It is very, very difficult for the patient to then live after that. So it is important for us to prevent these kind of severe things, say no to bad habits, and we can motivate our patients not to have these bad habits. So we must maintain great health by taking care of the teeth. First dental checkup for the children should happen at the age of 2.5 years. First orthodontic checkup should happen at the age of 6 years. Now, why am I saying 2.5 years? Because the baby teeth are important for development of the speech, for chewing food, and for overall health, for the proper growth and development of a child overall. Then proper development of the jaws and the orofacial structure. The teeth are very important. And for development of the good self-image, confidence and self-esteem, the teeth are very important for young children also. How it has to be preserved. Brushing properly, we have to inculcate good habits, right? At times, a pediatric dentist sometimes might suggest that the child has got multiple deep cavities and it requires multiple teeth, which requires root canals, and the child has to be treated under general anesthesia because the child is very scared and uncooperative. Yes, please go to the doctor, pediatric dentist, who will treat this child under general anesthesia, under the care of pediatric anesthetist, and the pediatric dentist can take care of these situations very, very well. Sometimes they also use the method of conscious sedation, and then the child becomes cooperative because the child is anyway very scared. Child is in pain, the child is very scared. So there are various methods of handling the situation. A pediatric dentist can surely help you in a fantastic way. You have to get the fillings done for the child in the milk teeth, and if the teeth are lost, then the space maintainer has to be put to prevent the dental orthodontic problem. What do I mean by that? When the baby teeth are present in the patient's mouth, the permanent teeth are actually growing inside. And these baby teeth are acting as a natural space maintainer. Now, if the baby teeth gets lost, because this tooth is going to erupt, this upper premolar is going to erupt at the age of 12 years. And if this tooth is decayed at the age of 6 years, then by the time this tooth begins to erupt in the mouth, the other teeth will drift towards each other and the space will be closed. So we have to make sure we maintain the space. So if you have cavities, of course, your child has a cavity or a grandchild has a cavity, please get it filled up by the dentist or pediatric dentist. If there are cavities like that where the tooth cannot be just saved, then the tooth is removed and the space has to be maintained for the erupting permanent tooth, which is developing inside the bone. It will come at its own time, and that time the space maintainer can be removed. This is done by the pediatric dentist as well as orthodontist. And another case where the space maintainer is placed, a small little space maintainer is just preserve the tooth. in case of early loss of baby to prevent the crowding in the posterior segment. Here you can see that the baby tooth is not fallen and the permanent one is coming from the outside. In this situation, if you have done your early checkup, then baby teeth removal can be advised by the dentist and the permanent teeth can be corrected with help of braces, right? If you don't take action immediately in such situations, then the severity of the malocclusion would increase. Of course, it can be treated later also. But the point is that why increase the problem and then solve it? You can do early intervention. Why not do that? Some children have some kind of habits. They have a habit of finger sucking or thumb sucking, lip biting, tongue twisting. So these children have to be tackled very carefully because there are deep reasons for this. So we have to do counseling for them. We need to give them habit breaking appliances so that they stop this habit, and we can correct this kind of open bites and malocclusions with help of orthodontic treatment. A very important point which generally gets missed by dentists and ENT specialists and the physicians is that the repeated cold and cough infection happening, adenoid becoming very large, sometimes causing adenoid becomes really large, and it's obstructing the air passage. When the air passage is obstructed there, the child is not able to breathe properly, and for the survival of the child tends to keep the mouth open and the mouth breathing habit develops. At this stage, while the child is already in a growth phase, what happens is that this anterior facial height increase, the growth direction changes, and the child's growth, which should have happened in straight direction, it changes to more vertical height in the front, and then this child develops incompetent lips and the gummy smile, and the child cannot breathe through the nose at all, and the entire jaw pattern gets destroyed. It gets worse, adversely affected. So if we have done intervention in such situations by doing adenectomy, like the ENT specialist can advise if it is indicated, then if it is done, then this kind of severity of the malocclusion of anterior increase, anterior facial height, and the spoiling of the entire face can be prevented. That is important. Now, what can you do with braces? What is the magic of braces that I would like to share with you? That the alignment of the teeth can be done at any age, first of all. The crooked and the malaligned teeth and the jaws can be corrected during the growing age. Orthodontic checkup has to be done at the age of 6 years to understand what are the problems and developing problems. And it is very important to have aligned teeth so that you can maintain better. If you have a furniture in your hall which is scattered, like there is one bean bag and one sofa and one chair and all that, you can't clean it properly. But if you have an organized furniture in your hall, then you can really clean it really well. Same way, if your teeth are organized in a proper arch form, in a proper level, in a proper occlusion, you can maintain them better and remain healthy because this machine is really working fine. So how the braces are done? The braces are done with the fixed braces, either with metal or the ceramic ones, or even the aligner treatment is available to have those aligners to align the teeth for the adults who require the treatment. I have created a poetry, and because I'm also singing, I have kind of created the poetry and created a video, and I posted it on YouTube. Maybe you can take a screenshot of this and you can listen to that video and learn in a fun way about braces for yourselves and your family members and young children. Now, some people believe that the orthodontic treatment should be done only when the child is like 12-year or plus, but that is not true. The child can be treated as early as in a mixed dentition phase. This child is just about 7 years old, and this child has got a tooth which is rotated like that. And the child is scared because the child is being teased by other people. So we have to be creative in the treatment plan, and we have created a special appliance to straighten this tooth of the child, and the child feels much better about himself. Another patient has got teeth which are coming out completely. If left untreated, this child would fall and have a fracture of the teeth. So this requires to be corrected. But diagnosis has to be done properly in terms of factoring in the growth potential of the child. And you can look at it very closely that the lower jaw is very underdeveloped. In this situation, we have treated him early on, and we have treated him without any extractions of permanent teeth. And you can see the transformation of the child in terms of the growth of the jaw as well as the beautiful alignment of the teeth. The teeth which were jetting out have gone inside completely. So another case where there is severe crowding of the teeth. The teeth are all in and out. The child is just unable to clean well. What we have done, braces are fixed, appliances are placed. Slowly the space has been created for the teeth which cannot be aligned, and they are aligned with help of braces, and then this is the end result. So this is comparative pre and post, pre-treatment and post-treatment. As you can see here, crowded teeth in upper and the lower and the aligned teeth. And how the patient transforms from that smile to this smile. And it is so satisfying to see the patient feel so confident when they have a wonderful smile like that. Another case where the child is young and the lower jaw is not growing properly. We have done the treatment to modify the growth of this child by giving her some growth modification appliance. And we gave her this appliance. This was a projection that from there to there she will reach, where the teeth are having the jaw is inside and the jaw will correct like that. And then this is how it is corrected. Actually, this is what the child wore the appliance really well, and we got that position of the jaw. And then at the end of the treatment, is with the fixed braces, that is how the patient's teeth settle. So that is the pre-treatment, mid-treatment, and post-treatment in terms of the facial change for this particular patient. And there is another case where the patient has got very severely crowded teeth. You can see that the teeth are very badly crowded. In some situations, we have to remove the premolars to create space because there is a jaw size and tooth size discrepancy. Now, you cannot just align teeth where there is not enough jaw bone or the space in the jaws. So in that case, you reduce the number of teeth so that you can achieve the alignment. Like you have 3 fat people wanting to sit in the Maruti 800, you have to tell one person that please come by another mode of transport. As simple as that. So here you have a x, and x is not x plus a, and x is not matching. The equation is not matching. You just remove that a, and x is equal to x. The equation can be matched by aligning the teeth. So we have put braces for her like that, and that was the post-treatment of that particular child, where you can see beautifully aligned teeth after we remove the braces. Another very interesting case I want to share with you at this point in time is a patient who comes with this kind of a smile. Apparently, nothing looks very off here, but when you look at it closely, you can see that there is a baby tooth present here. And where is the permanent tooth? Where is the permanent canine? Here there is permanent canine, but here where is the permanent canine? On the left side. So we take an X-ray. What do we need? What do we see? We see the canine which is impacted inside. Now, at this point in time, we have to plan the mechanics in a way that it doesn't damage the other natural teeth and the tooth is brought out and back into its position. So we have planned the case, we have opened the tooth by surgical exposure, and we have to guide this tooth into its place. So we put some attachment there, and after that, we are guiding the tooth with special mechanics to bring the tooth back into its position. So that is what tooth is going back, and the tooth is walking back, and the tooth sits into its position. And then we can see that this is the beautiful occlusion achieved for that patient, and the smile now looks much more aesthetic. Sometimes the children have not done the treatment at young age, and they come at a very old, like around 28, 29, they feel still very conscious about their teeth. The mouth is not closing. This particular case has got severe prognathism, like the lower jaw is inside and the entire upper lower teeth are projecting out. We have treated her with ceramic braces, with straight away taking support from the bone, and then the teeth have been taken in. And you can see how beautifully the teeth have gone inside. There is so much of ease on her muscles here. She can close it so easily. And you can see the comparative view that the prognathism, like the teeth which are so projecting out, has gone inside, and she looks much more aesthetic. So that is the post-treatment of that particular case. So when I talk about the braces, orthodontic treatment can be done at any age, provided bone condition is good. For replacement of the teeth in adults, tilted teeth can be straightened up. I'm going to mention this later also in the presentation in the prosthetic department. Generally, it may take 12 to 24 months, but it depends on the severity of the malocclusion. With aligners also, the treatment can be done for the patients who are shy to wear the metal or ceramic brackets. Now, if you have teeth which are infected, then who can help you? The oral surgeon can help you. Basically, the infected focus from the mouth has to be removed. The healthy oral cavity has to be achieved so that we have a healthy heart, and we should have the relief from the pus discharge and the pain. Right? Now, when you remove the teeth, when you remove the infected teeth, what should you do? Should you leave that alone? No, you should replace it. So replacing of the missing tooth can be done even for a single tooth or a multiple teeth, or even if you lost everything, then you can have the complete replacement. What happens as you lose the teeth, we are unable to chew well. It affects our general health. Our speech also gets altered, and our facial structure collapses, and we start looking very, very old. It is so important for us to understand that the geriatric care is so required. The old patients, their entire system is slowing down. They are not able to walk as much. They are not able to sometimes they are not eating well because they don't have teeth, and then they get into a weakness mode and all that. And the nutrition gets affected. So it's very important for us to understand that for the old members, our respected elders in the family, we have to make sure we have to motivate them that if they are in a hopeless state that abhi kya kitna jeena hai kyun karana hai, lekin we have to motivate them that you should have your teeth, artificial teeth, so that you can eat better and you can feel better, and then they don't have issues like constipation and all that, because they are not eating enough fiber, and then they are having constipation. The problem is that they don't have teeth to eat with, so that is why the other systemic issues are coming. So we have to help them with replacement of the teeth for the better chewing, better digestion, better overall health, and it is important to have a proper occlusion while we have to replace the missing teeth. If some teeth are missing, the other teeth tend to drift like that, and when they drift like that, and when you want to replace it with some implant or something, short-term orthodontic treatment can be done to align that, open that space, align the teeth better, and then have a prosthesis there. That's what can be done for single tooth replacement also. And single tooth and multiple teeth can be replaced with various means. And I will just share one case where the one tooth was lost here. As you can see, one tooth is lost here, and we have replaced it with an implant there. And now, without cutting the neighboring teeth, with the help of bridge also can be done. But this patient chose not to cut the neighboring teeth and put a bridge, but go for a single tooth implant. So we did that for her. And if the patient has got a condition where the patient has got multiple decayed teeth, then you require to do a full mouth rehabilitation for this patient. You have to remove the infected teeth. You have to save as many teeth as possible by root canals and cover them up with caps, and then replace the missing teeth which are not there. This is a case where the patient has got multiple missing teeth, and we have replaced it and improved the smile of the patient. So in conclusion, I would like to say that regular dental checkup every 6 monthly must be done, and maintain good health of your teeth. Checkup for braces should be done every 6 years. Proper history should be given to the doctor. Follow all the instructions about medication and treatment, and maintain properly after treatment. I wish you well for staying happy, staying blessed, and keep smiling. I thank you all for your attention and your time on this Sunday morning. And if there are any queries, any questions, you can first of all visit our website for more information about me and my husband and our team. And we have this email address on which you can write to us. You can reach to us on WhatsApp on this mobile number, and then we will be happy to answer your queries and guide you further. So thank you so much, all of you, for your time and attention, and hope that you gained a lot of information and knowledge, and it will be helpful to take care of your loved ones. Over to you, Dr. Sandeep.
Thank you very much, Dr. Vashi. This was a really, really great session. And one question is there any good book for the common persons for dental health you can recommend?
Well, I need to write one. I don't know. So far, I don't know if there is any book like that for the common man, but maybe I should find out if there is one, and then I'll share the reference with you. And if not, then maybe I'm inspired now that I should do something about it.
Or my friends, you can watch Dr. Vashi, there are one or two things. The questions are there.
Yes, your volume is very low. I mean, can you increase your volume?
Dr.
Ma'am,
Ajay,
there
one question.
ma'am, there is question regarding electronic toothbrush. Which
Okay.
electronic toothbrush we should use?
So electronic toothbrushes can be used, any brand you can use, which is having good oscillation or vibration. But my point is that that brush should be touching the surface of the tooth for enough time, right? So like if I have a vacuum cleaner in my house, does it mean that my house is spick and span and clean? No. It has to reach every nook and corner, then only my house will be clean, isn't it? So you have to put the electric brush on each and every surface of the tooth, outside, inside, chewing surface, and all that. That is how you can use it, and then you can treat any brand, like Colgate, Oral-B. There are good brands which are available, and that can help you to clean your teeth with the electric tooth. Especially if like you come across some spastic children or some children with some retardation, or at the old in the old age, if the patient is having some kind of palsy or some issues with the muscle tone, or the finer movements are not happening by them, that can be a great aid to use the electronic toothbrush for all of them.
There is one more question, though we are talking much more on the spiritual or holistic health or the preventive side of the diseases. So, Dr. Vashi, there is one view and one question is there, that there is a doctor, you must have heard about Dr. Nandita Shah, Sharan India, and
Mhm.
she's promoting, and many other persons are talking about this, that dental health, like other diseases like diabetes and heart disease, it's a problem of modern science and modern food. Like people are taking so much sugar, they are taking milk and other kind of things, that she has not brushed her teeth from last 30 years and her teeth are very good. So your views that if we can change our food, that we were talking about the that Stephen's curves and the heart diseases and the correlation with heart disease and dental health. If we change our food habits, that both things can be cured. But if we're working just on the symptoms, which are in the signs and symptoms like plague and other things are there. So can we say something about the food also, that this is the main reason preventive work can be done?
So I already mentioned that the food habits, like if we don't have balanced diet, if we don't have fibrous food, then we are likely to get more problems, dental problems. And about the Stephen curve, which you mentioned right now, it is basically that when you have sugary, ideally it should not be, one should not have sugary food, right? But then we do indulge, children do indulge, everybody indulges into the sweet foods. So in that situation, what is the solution? That is what I said. Now when you are, the tips that I can give you is that the brushing the teeth twice in a day can surely prevent the dental problems. That's one. Number two, that if you are eating food, if you want to eat sweets, you incorporate along with your food, meaning you have the sweets while you are eating your meal, and after you finish the meal, you brush your teeth, and then you are over and done. That would be additional brushing, but that's additional care, which would be very helpful. And the third thing is that we can eat fibrous food. You know, we can eat those in between snacks. Sometimes when we are eating something which is really sweet or something, instead of that, we could go with carrots and certain salads which are very fibrous. That would be very helpful to have a natural cleansing of the teeth. My suggestion is that cleaning the teeth in the night before you go to bed is very crucial. If you don't brush at that time, the salivary flow also is reduced, and the food, whatever is sticking around, sticks around, and damages happen in the night for people who don't brush twice. So I recommend that they must brush twice in a day.
Ma'am, one
Ma'am,
more thing is there, that if we can stop milk and all the sweets to the kids from the birth, that up to 90% of the orthodontic problem can be solved.
So
Or will not
the
come.
dental problems can be like, basically the oral environment will be better. So you can avoid sugar. That's always helpful. Yes, that's always helpful. Orthodontic treatment is orthodontic problems, like basically the alignment problems happen because of the discrepancy in the jaw size and the tooth size. So if the mother has got a small jaw size which the child has inherited, and the father has got a large teeth which the child has inherited, there is going to be space constraint. So the orthodontic problems will not be only because of the decayed teeth, but it can also be because of certain conditions, genetic predispositions, and because of which the teeth are coming crowded, and that they can be corrected simply by putting braces.
Right. Thank you. Thank you very much.
Ma'am, there is one question regarding rinsing mouth with coconut oil for oral
Yes.
hygiene.
Yes. So the oil pulling is a thing which is done by a lot of people who are following Ayurveda, and I studied about it because in last webinar also somebody had asked this question. So I studied about it. There is no statistically significant correlation found by doing oil pulling and preventing dental diseases. Like there is no statistically significant articles that I find in the journals which would give me that information. So the Ayurvedic practitioners do that. Ayurveda, like they use the sesame oil and the coconut oil, but there is no statistically significant data yet found. So maybe some spiritual doctors can do that kind of a study where they do that, and then that disease incidence can be found, and that research can be then published. We can surely think of that, because even Colgate has come out with those products of Dantakanti paste and those oil pulling liquids and all that. So probably some research, I'm sure, is going on, and something will come out of it very soon.
There are many questions, ma'am, and they are mixed up. Homeopathy toothpaste. Answer this question. Homeopathy toothpaste or fluoride containing toothpaste? Which one is good?
So yes, somebody is writing clove and dental health. Yes, clove oil is known for preventing, I mean, basically solving your dental pain, but that is a temporary, like you are in pain and you put the clove oil and you feel better, but the mechanical treatment of removing decay and filling must be done. Regarding the paste, yes, any paste with fluoride is good. We are going to use the paste to create foaming agent in the mouth, and then we are going to spit it out. We are not going to ingest it, right? So it is not going to be harmful to us in any way. We just have to brush our teeth with that and spit out everything which is there in the mouth, along with all the dirt and the food and the plaque and everything. So fluoridated toothpastes are recommended for everyone. And lastly, about homeopathy, one question has come about homeopathy. So I would like to mention that when the children are given, homeopathy is a beautiful science. Homeopathy gives wonderful results, and homeopathy should be taken. I also believe completely in homeopathy. But what I believe is that after having homeopathy, we must brush our teeth because it's pure sugar pills. If we don't brush our teeth, our children don't brush their teeth post the thing. Patient is not having sugar, patient is not having chocolates or sweets or anything like that. Maybe the patient is on homeopathy can develop cavities because of the sugar pills. So it is very important that we educate. The homeopaths can educate the children and the patients that please have homeopathy, but then please clean your teeth also so that you don't develop cavities.
So I think most of the questions have been covered.
I am also reading the chat, and everybody is very happy with the session. They are kind of very well informed, and I'm happy that it has contributed to the knowledge and information for everyone.
What should we do to minimize sensitivity?
Right. So the sensitivity, we have to first of all find the cause. What is the cause of sensitivity? If the sensitivity is because of the decay, then the teeth have to be restored. If the sensitivity is because of the wear and tear, the brushing technique has to be corrected. If the sensitivity is because of certain chewing habits, that you are bruxing your teeth, you are so stressed that you are clenching your teeth constantly, or in the night you are grinding, your partner is saying that you are grinding your teeth and so much noise is coming in the night. So then you have to work on your stress, that you don't feel so stressed. Maybe treat the sensitivity by doing some restorative material, feeling on those teeth, and use desensitizing pastes also for the prescription of the doctor. So first find the cause. Don't just look at the advertisement of Sensodyne and start using Sensodyne just because you are having sensitivity, because your problem might be growing deeper inside and you are just doing the paste and feeling better on surface. So it's best to get it investigated by dentist, professional dentist, who can look deeply into your mouth and find the cause and cure it and help you and guide you.
Any more questions, friends? You can type in the chat.
Somebody has asked that some people have brittle teeth. So basically, the brittleness of the teeth is because of the way the bite is, and that bite which is there, which is causing the constant heavy forces, can cause the brittleness of the teeth. So that condition has to be evaluated by professional examination. Somebody also has put on the thing that how do we control acid reflux. So the acid reflux, if it is coming, if it is reflux, then it is coming from your stomach acids. So you have to take probably some medication for that. Yeah, and we also have to, as spiritual doctors, we know that there is a deeper cause for it. So we have to find the deeper cause, root cause, and sort that out. Right?
There's last question that 2 times this question has came, that chewing gloves is good for dental health. Regular chewing of the gloves.
You may feel a little fresh because of that taste of glove in the mouth. But I mean, we don't recommend that you should keep on chewing gums or exercise your muscles with all that and all that. We don't recommend any of those things, right? Keeping the mouth clean, not constantly chewing on anything, is the best thing to do. Eat your food, eat your mukhas, your glove or whatever you want to eat, brush your teeth, and then don't eat for a number of hours to keep your mouth very, very healthy. Drink enough water and maintain it well.
So I think most of questions has been answered. Thank you very much, Dr. Vashi. This was really, really nice and informative session. That we request you that if some questions come, and we would love to call you on our channel next time with another topic.
Sure, definitely. I would be more than happy to answer all the questions if they are there, and more than happy to come back again with different topics. And congratulations to both of you for doing this wonderful work, and all the audience, all the participants who gave their time and attention for this lecture, and who are constantly, regularly coming to this and contributing to the patients whom they are treating by touching their lives by the wisdom of the holistic care in all the aspects. So thank you so very much for this opportunity.